stars at night.
Yeah.
That's true, right?
Well, I'm certain we're going to fill this this hour with conversation very easily. So I'll just go ahead and start us off. I think we're all here tonight because either we know and love someone who's older, or can I say senior? Is that politically correct, or is
You know what we've been using recently is seasoned adults.
okay?
Seasoned adults.
I'm happy to use whatever makes people feel good. So we all either know and love a seasoned adult, or have found ourselves seasoned personally. So I think, and yet today we face a huge crisis, both in the pandemic and also a larger question of how we can better integrate seasoned adults into our community. And with COVID, of course, the pandemic is a greater risk for serious complications and death for the older adults. And then there's also this catch-22 of our solution for COVID is that we all shelter in place and stay isolated. But we also know that more and more there's serious health impacts from isolation and loneliness. And I mean, you can easily check this yourself on the CDC site. Social isolation was associated with about a 50% increased risk of dementia, and loneliness among heart failure patients was associated with a nearly 4 times increased risk of death. 68% increased risk of hospitalization, and 57% increased risk of emergency department visits. So clearly we're social creatures, and we need to find a way to maintain that throughout our entire lives. And so as we look at dealing with COVID, we need to also make sure we're solving this larger issue and being attentive to how to make sure people are still active members of our society. So as someone running to be your next county supervisor here in Santa Cruz, I believe that county government has a very key role to play, whether it's through health and human services we provide as a county, or even through housing and creating more intentional communities where people, it's more multi-generational, people have more natural opportunities to form community and interact with one another. So I hope that tonight you'll listen to these 3 great speakers we have, which I'll introduce you in a moment, ask them tough questions, and I hope we can all walk away with a sense of what we can do in our own lives for ourselves and the people we love to keep everyone safe during this pandemic, and also what we can do as a county and local government to begin implementing policies that are going to be more inclusive of all ages going forward. So with that, I want to introduce my 3 very wonderful panelists that are here tonight. And I'll start with John Beleutz. Hi, John. John is the Executive Director of the Health Project Center. And if you don't mind, I'll just show a little slide here so you guys all get a visual of what it is that the Health Project Center does. And I think it's pretty cool. So basically you have 3 core programs, if I understand correctly, John, and one as the Del Mar Caregiver Resource Center is for folks who are caring for an elderly family member, and it helps them the best ways to do that. Then you've got the Central Coast Area Health Education Center, which is really for people in the medical field to improve their care in geriatrics and other health services. And then you have the Multipurpose Senior Services Program, which is sort of the do-it-yourself wing, if I understand correctly, and a way for people to help themselves maintain independence throughout their lives. Does that sound like a good summary?
That's a great summary. Thank you.
And you've been doing this for,
it's a pleasure to be here.
Yeah, you've been doing this for, is it 14 years?
Yeah, I've been doing this for 14 years. I've been Executive Director at Health Project Center. That's correct.
Awesome. Great. I'll give you a second to 5 minutes or so to talk more about your work in a second. I just want to introduce everyone else as well.
Thank you.
Yeah, thank you. We also have Bonita Sebastian here. She is the president, Bonita, president of OLLI, the Osher Lifelong Learning Institute at UCSC. And OLLI is actually a nationwide organization, but it started here in California and I think very on at UCSC as well. And OLLI has over 700 members at UCSC and provides a range of learning opportunities from these adventure group or interest groups like this adventure and digital photo group, as well as a couple of courses per quarter that people can partake in, and meetings on really interesting topics like this one that happened just recently by professor and department chair of politics at UCSC on China today and the politics under Xi Jinping.
Xi Jinping.
Yeah.
Right.
So Bonita, thank you so much for coming tonight.
Yes, I'm delighted to be here and let people know a little bit more about OLLI. That's what we call it, because it's too long to say Osher Lifelong Learning Institute at UC Santa Cruz. We just call it OLLI.
Yeah, I'm really looking forward to learning more about OLLI.
Yeah, good.
And last but not least, we have Clay Kempf. Hi, Clay.
Hi.
Clay is the executive director of the Seniors Council, which is active in both Santa Cruz and San Benito counties, but also provides services in Monterey County and Santa Clara County, and has 5 key programs that they offer. So they're the Area Agency on Aging, offer Foster Grandparent Program, the Senior Companion Program, Project Scout, and the Companion for Life Project. And I believe it's through the Area Agency on Aging, Clay, that you're also the, you're working on the state master plan for aging. Is that right? Do I have that relationship correct?
Yeah, that's correct. That's a statewide group. I think there were ultimately 34 people on it, so I was lucky enough to be one of those to contribute. And
you're the legislative co-chair.
I'm the legislative co-chair of our state association, which is another mouthful, the California Association of Area Agencies on Aging. So for obvious reasons, we would just refer to that as C4A.
Got it. Great. Well, as from one policy wonk to another, I'm excited that you're here tonight and can really help us understand what it is we can do from a policy and programmatic perspective for county government to serve our seasoned adults better here.
Appreciate being invited.
Thanks. Yeah. Well, now I want to give you guys all a little bit more of an opportunity to describe your work yourselves. So why don't we go back to you, John, and yeah, tell us about what it's like being executive director of the Health Project Center.
Well, thank you. It is a pleasure to be here and tell you a little more about what we do. I've been executive director of Health Projects Center for, as we mentioned, over 14 years, and it's really a pleasure to be working each and every day to really try to help folks to, to live a better life, to support our community members. So I feel privileged to have the job. Let me tell you a little about Health Project Center. Our main mission is to support people as they age and live at home, to be safe at home. We work to deliver programs in the Monterey Bay region. We have Santa Cruz, Monterey, and San Benito counties where we go. What we're really seeking is a community where people age with dignity and good health at home. And we seek a community where people receive supportive health and social services in the least restrictive environment possible. So in short, we're really trying to keep folks out of nursing homes unless absolutely necessary. And I don't think I have to explain why. I think most of us don't dream of ending our lives in a skilled nursing facility, as well as good as work they do is. And especially today, as we know, as we were talking earlier, there's an outbreak at one of our local skilled nursing facilities of COVID. And it does, just another reason why, we need to be working hard as a society and as a community to engage older adults and to make sure that they can be part of communities and regardless of their health and have dignity at home. And that's really what our programs are all about. Let me take a couple minutes to tell you about our programs, and and happy to answer any questions and about the issues. So our first program is the Del Mar Caregiver Resource Center. And that is a program that works with family members, the caregiver caring for a loved one at home who has some sort of a cognitive impairment. And that may be Alzheimer's disease, Parkinson's disease, traumatic brain injury, and the list goes on. It's really a free program, though, funded primarily by the state of California and from local philanthropists and donations to support those families. And pretty much anyone has known somebody or known a family that's had to deal with Alzheimer's or related things, and it isn't easy. And it's not something you understand unless you've done it. And we're here to help through our Caregiver Resource Center, which is part of a statewide network that serves all counties in California. So no matter where you are, that service is available. But Health Project Center has the honor of doing it here in this region. So in brief, we work with a family caregiver. That's the client. We help them to provide quality services to their loved one, which they need to do, and they were not trained to do. They're not medical professionals, but they may be providing medical services. And we work to keep the caregiver healthy and in a good place, and taking breaks and taking care of themselves. Because unfortunately, I've run across numerous occasions where the caregiver physical health is not as good as the care receivers. And we've had, and that doesn't help anybody. And we've had caregivers pass away who were caring for someone, and that doesn't help anybody. And not that anything's preventable, but there are a lot of things that are. We can, and so we provide one-on-one consultation with a family consultant who will work with you to work through your issues. We provide education and training and classes, which we're doing all of this remotely as well. Given the situation on Zoom or by phone, or we'll see people when need be. But again, we're minimizing that because of the health issues. We produce support groups. We have, you can, on our website, you can go on there and you can start your caregiver journey there. And we have an online health portal. So you can start putting your information there that's secure. And then we'll connect you with an individual. So there's a wide range of supportive services that the Caregiver Resource Center can provide free of cost. So if you know of somebody who's caring for a loved one with cognitive impairment, have them give us a call, and they'll be quickly connected with a family consultant who can do a personalized assessment of the situation and help them develop a plan. And we've been doing that program since 1988. So it's really, it's been a mainstay of what we do here. The Area Health Education Center, I'm going to talk about our next program here. Central Coast Area Health Education Center is part of a statewide and national network of organizations working to keep people safely, to keep healthcare professionals trained and healthcare students trained so that they're working with underserved communities. So we really focus on that. And here locally, our Area Health Education Center focuses on geriatrics and care management in the community, which really fits in with our programming. So while with the Caregiver Resource Center, we're helping the caregiver so they can help their loved ones stay at home. With the Area Health Education Center, we're helping the healthcare workforce to help keep people at home. And most recently, we've been working with the counties of Santa Cruz and Monterey to do trainings for the in-home supportive service workers. So we partner with the county government there to provide that supportive service training. And finally, the MSSP, the Multi-Purpose Senior Services Program, MSSP, as you can see why, provides free services, free care management services that are for older adults who are very low income. At present, we provide about 320 people with services. And these are folks who could be in skilled nursing, and they have a level of care that requires it, but they don't want to be there. And these are also folks that if they were in skilled nursing, the government would be paying for 100% of that cost, which, that can, and what you're looking at there of cost can be over $100,000 a year, depending on how how you look at it, slice it and dice it, but however you look at it, it's a lot of money in this, and our clients don't want to be in skilled nursing. They want to stay at home, and we help them stay there. Our nurses and social workers both coordinate care and services that are already out there, and as well as purchase things that maybe nobody else can provide and that are needed though to keep people safely at home. Say a leaky roof. It's a creative way that your Medi-Cal dollars, that's government dollars, can actually pay for fixing that leaky roof rather than taking that person and moving to a nursing home where the roof won't leak. And the cost difference is huge. It's a program that, again, it covers most of California. It's innovative, and it's really, again, targeted our mission, which is at keeping people safely at home with dignity and providing their services for them in a way that they can stay at home. I appreciate the opportunity to talk about what we do, and glad to answer any questions, and I'm glad to be here.
Thank you, John. That was an excellent overview. And I think that last program particularly highlights that frequently these programs, they're not only are they better for the individuals, but they're better on our collective pocketbook. So by implementing services smartly, we can make sure outcomes are better for everyone, and also a lot more cost effective. That's really interesting. All right, Bonita, tell us a little bit more about OLLI.
Okay. It used to be simply the Lifelong Learning Institute, and it was what was called a friends group at the university. And it was started back in 1984 by a group of individuals who wanted to keep on learning. And we're loosely affiliated with the university, but we have maintained our independence, and our entire organization is run by volunteers. So that's something that makes us a little different from some of the other Osher Lifelong Learning Institutes in the country. We've been able to keep our dues very, very low and affordable for folks. We have scholarships for anybody who can't afford it. And as I said, we have close to 700 members right now. And what happened, the reason we got the Osher is that Bernard Osher, who gives money to organizations such as this, which organizations that are associated with universities and colleges, approached us in 2009 and offered this $1 million endowment if we would grow our membership, which wasn't as high at that time, up to 500, and adopt the name Osher Lifelong Learning Institute. So it was kind of a hard thing to turn down. So the university helps us with managing that endowment, which pays out once a year, that helps to fund some of the activities. As I say, we do charge dues, which are minimal. We have 4 elected board members: president, vice president, secretary, and treasurer. Each serve for a term of about 2 years. Some last a little bit longer, some shorter. We have a relationship with colleges. 2 of the colleges in particular, colleges 9 and 10, 2 of the ones that haven't yet been named. And we do projects with them. So there's a lot of interaction between the students and our folks. Our folks do mentoring. They have a project that they do every spring, although not this year, which is called the Alternative Spring Break. So particularly for students who can't go home during spring break, we do a project in Watsonville. We plant a community garden. We visit some of the activities that are going on down there. We paint murals and those kinds of things. So that's been a very nice project, and doing it in conjunction with the students has really been very rewarding I think on both sides. COVID, of course, changed a lot for us. So we now basically run everything through Zoom. Even our interest groups meet little groups, although I did see one of our recorder groups meeting out in the park, and they were sitting 6 feet apart, each with their own recorder, playing a tune together, which was kind of nice to see. We meet monthly, basically during the school year. We don't meet in December. We don't meet in July, August, June, July, or August. So as you can see from this, we have activities that include these interest groups. There are about 60 of them, and these are peer-led. So we have people who are interested in something like taking adventures, doing digital photography, learning French. We have several New Yorker groups, book groups, dining out groups, all of those kinds of things. And anybody who is a member who would like to can start an interest group, and they become the leader, and then they arrange their meetings totally independent of the rest of us. Our general meetings, as we mentioned before, once a month. As I say, we just had a great one with Ben Reed. We're very lucky to have access to a lot of the professors at the university, so that they do some really wonderful presentations for us, because we're all dedicated to continuing to learn. One of the things that we've been spending time learning lately is how to run meetings virtually, how to work with Zoom, how to make that work for all of our participants. We put out newsletters. We were doing them when the pandemic first started. We were doing 2 newsletters a month. We're now cutting that back to 1 newsletter per month. We alternate either sending them through email or actually printing and sending something that people can hold in their hands and read from time to time. Courses, we were doing probably 10 courses a month. I'm sorry, 10 courses a quarter. And now we're doing 1 a month. So we currently have courses for Supreme Court decisions, women's history, and this is in ancient times, and world affairs. So those are things that where we have some great folks from either the community or from the university who lead those courses as well. We do use our dues money to provide scholarships for students, and we have now a virtual program where the students can apply for scholarships. We just awarded 30 scholarships of $1,500 each. So we're pleased and happy to keep that one going. So basically what we're doing is socializing and learning as we go along. We have a lot of members helping members. So we have reached out and connected members. If somebody needs help with something, we do carpools, we do all kinds of things. And now that, of course, with the fires and people losing their homes, we've been reaching out to any of our members who need help in that way to try to connect them with someone else. So I think that's about the overview.
That's fantastic. Yeah, and I think you said it right there. Why I was so keen to have you on this panel, Bonita, is that you're socializing.
Yes.
And you're that is pretty much the antidote to isolation. And not only that, but you're doing it in a way that is stimulating people's minds and continuing to learn new things. And it's what I love about this your program is that it still has that social element very much. So unlike maybe some of the flashier online learning platforms like Coursera or something like that, or Khan Academy, yours is still very much grounded in a community. So I think that's very cool. And,
yeah.
And I think
we enjoy seeing people tune in and they're able to ask questions. You know, we use the raise hands feature to let people ask questions, and it's been very satisfying to see the response that we have from our members.
That's fantastic. Yeah, thank you.
Thank
Clay.
you.
Yeah, Clay, if you could just, I know you do a lot at the Seniors Council, but if you could give us an overview of your work, both at the Seniors Council, and I can put whatever slide you prefer up here, and also with the state's program to create a master plan on aging.
Yeah, this is a good slide for me, so thanks for having that up. And I'll talk about each program pretty briefly, and then maybe talk a little more about the AAA, since I think that's probably the most interesting piece for this discussion. So like Health Project Center, we're a private nonprofit, and the mission that John's organization has in mind is really pretty similar. Ours is to enable older persons to function with independence and dignity in their homes and in the community to their fullest capacity. So both of us kind of touch on improving quality of life, and I think that's, you know, dear to each of us and all of our staff as well. So to achieve that, we started just as the AAA, but since that time we've added these additional programs, and I'm going to go through them from smallest to largest. The smallest one is Project Scout, which is a volunteer-driven program. We have one staff person that coordinates about 35 volunteers that help seniors and low-income families prepare their taxes each year. So we have a big seasonal push with that. The season starts before tax season starts because we have to get all the volunteers trained in the latest tax laws that evolve each year. And they all have to be IRS certified before they can start formally volunteering to help people out. Next on here is Companion for Life, which is kind of the Help Me I've Fallen emergency response buttons. Those are a commercial product. The difference in what we do is that we do have a sliding scale for low-income seniors that can't afford the over-the-counter rates. But I think more importantly, our staff person visits each person that subscribes with us and you know, gets the system up and running, tests it with them, makes sure they understand how to use it, and does that hand holding that you can't get if you buy this at, you know, Walmart or online. So that hand holding is really important. Also, if something goes wrong with the system, it gives somebody to call to troubleshoot it that'll come out to again, to the house as needed to fix things. The next two on here are closely related: Senior Companion Program and Foster Grandparent Program. These use low-income seniors in our community to, in the case of the Foster Grandparent Program, help school kids, or in the Senior Companion Program, help other seniors. Foster grandparents, the easiest to describe. Essentially, we place volunteers, typically between 15 and 25 hours a week in schools to help with some of the more difficult students in the classroom. And difficult, probably not the best term to use, but challenge is a better term, and the challenge could be behavioral. It could be a learning challenge with math or with reading. And having an older adult in the classroom gives that person, that student, additional attention, whether it's academic or behavior-based. Has amazing success. That operates through the year. We participate in summer school classes. It's one of the big challenges we have right now with COVID, with schools being closed. How do we do this? So we're in the process of trying to figure out ways that our foster grandparents or volunteers can contribute to distance learning in schools. Senior Companion is the same model, except seniors help seniors. And we do actually a fair amount of work with county mental health departments for seniors who are particularly lonely or isolated. And part of what some of the volunteers will do is just take the people they're assigned to just for a drive. And I think all of us, you know how much fun it is to go, drive along the coast or drive along West Cliff or Sunset Drive in Monterey. We all feel better after that. So for a senior who's particularly isolated or depressed, it's an extremely effective way to just uplift somebody's spirits. The last program and the largest, and this was what we were established for, is to be the area agency on aging in Santa Cruz and San Benito counties. And every place in the US has a AAA. We're the other AAA though. Every place has an area agency on aging, which is part of the Older Americans Act. And the mission of a AAA is, it's threefold. One, it's to provide direct services. Two, it's to fund other agencies. So in our area, when Older Americans Act got started, there were already a variety of rich services in our community. So rather than duplicate what those programs were doing, we took the approach of let's look at who's the best of the best within our community and let's fund them rather than compete with them. So Meals on Wheels is one example of a program that we fund with primary funding source for them. So a lot of folks know the programs we fund, not so many know what the AAA itself is. Other examples of the service that are funded are some specialized transportation. We fund senior citizens legal services and fund information and assistance in a variety of things that Senior Network Services provides. We also do some family caregiver support. And then we have some programs that we, also Ombudsman, which is nursing home protection, and then some smaller programs that we kind of supplement. Volunteer Center, Vista Services for the visually impaired, and Family Service Agency, which does senior peer counseling and IU Venture for people in nursing homes. So that's part two, provide direct services, fund other quality services. And then the third thing is we're designated to be the advocates and voices of older adults in our community. And for the AAA, older adults are defined as 60 plus. So if there is a new policy coming out locally, statewide, nationally, it's our mandate to actually speak to what or how those new policies will impact older adults. And in a lot of cases, there's not a whole lot of impact or a whole lot that we can do. But in other cases, we get very active. And senior nutrition is one example in recent years where we've noticed how many seniors are going hungry throughout the state, throughout the country. So we've led efforts to increase funding for programs like Meals on Wheels. For a number of years, for various reasons, those efforts were falling short. It seemed like they got a little closer each year. And in our strategy about getting turned down, the next year we would actually ask for more money, not for less. So we're trying to make up for the years when we didn't get funded. Last year, we finally had success where senior nutrition programs were augmented by $17.5 million around the state. So pretty happy about that. And hopefully we can keep that up in coming years. You mentioned a couple times the Master Plan for Aging. This is an initiative of Governor Newsom where he's acknowledging how rapidly this population is growing. And as John was saying, if we do nothing and just let everybody age in nursing homes, that's extremely expensive. So the challenge was kind of to find a way to improve the quality of life of this growing population and meet the demands both socially and spiritually, and also, look at the cost benefits that we could end up saving with this. So, that plan's had its ups and downs as well with COVID. When we started this, and the governor has spoken to this, that he was taking over a state that had a booming economy, that had reserves up to the max, and was ready to fund and create lots of new dynamic programs. COVID hit, the economy crashed, the Master Plan for Aging group started to just not convene for a while, and now that we're back at it, we're still trying to create lofty goals. But there's a huge shadow, which is how do we do this without any money? And how do we do this in a post-COVID world when all the interactive programs that we were trying to develop or that we were already operating can't be done in that way, that have all pivoted to something different. So that work, the Stakeholder Advisory Committee completed their work last week. And the document now goes to the governor's office, and the governor is working with other state departments to finalize it with the anticipated release for December. What I've said about this is it was a huge lift to come up with that plan, but the real work starts now, because anybody can write a plan. The challenge and frankly the success of that plan is whether or not anything gets implemented. So in the coming year, you know, it's time to implement this and see what we can do given all the challenges that we face. The last thing I'll say is just a reminder to everybody who might be involved in this, and John will be one of the people who's involved. There are years where he and I see each other more in Sacramento than we do locally, and we always kind of chuckle. It's like, oh, you're back up this week, you know, and you know, we work hand in hand in a lot of these efforts. But it is a 10-year plan. So that gives us, I think, the opportunity to focus in the early years right now during COVID to look at policy changes that aren't necessarily costly. And as the economy recovers, get a little more aggressive on some of the more innovative programs that we want to try to put in place that will have a budget attached to them.
Great.
So I think that's more than enough in terms of the background of the things we're doing and working on.
Yeah, a lot of really interesting programs there. I mean, I really like the volunteer grandparent program, which is, you know, again, combining youth and seniors as well as the companion program. I think what the kind of body of your work really demonstrates is the power of volunteerism. And again, creating that social connection and creating a lot of really valuable services for relatively, with relatively little financial input. So great, wonderful overview from all of you. Let's move to some questions. And you know, as John mentioned, COVID is a little bit top of mind right now because we just announced our 9th death in the county here. There's 2 more, which are not confirmed from COVID, but could be. It seems likely that they will be. And tragically, we have our first outbreak at a skilled nursing facility, Watsonville Post-Acute, where 27 of the 73 total residents have been confirmed positive. 6 staff members have been confirmed positive. And so it's a real reminder that COVID is still with us, and we need to do everything we can to shelter vulnerable populations. So if you could all just share with us, you know, what is it that you would all suggest that we do first individually? You know, what's the one action we can take individually? And then an action that we can take collectively, either as a policy or some larger group action that we should implement to keep everyone safe. Yeah.
Exactly.
Mm-hmm.
A mask.
And think of older adults think of anyone you know, really anyone you know who might be isolated, and you know, pick up the phone. You know, that is something any of us can do as an individual. And you know, there are 20-year-olds who feel very isolated right now, and there are 90-year-olds. And certainly we know for older adults there are more challenges because they may have less access to the technologies that are keeping some of us connected.
Mm-hmm.
Yeah, those are some of the things that we've been trying to do as well. Just, you know, connecting people. Talk to this person, talk to that person, help this person get set up to enable them to use the Zoom app so that they can join in on some of these activities, because it really helps. It, you know, just seeing another face is so important, and having somebody to talk to, it's great.
Yeah, I'd much rather hang out with you in person, but barring that,
Right.
this is, you know, at least it's somewhat better then
It's
a
what
lot
we
better than
have
nothing.
right now.
Yeah.
Yeah, it's what we have right now. And so, you know, that's one of the things that we said at the beginning is, you know, what is the nature of our organization? And we decided that we are resilient.
Mm.
And we're just going to keep doing that as long as we can.
Mm-hmm. Yeah, so I mean, and if we talked a little bit about volunteerism, and I remember at one Board of Supervisors meeting where a lot of folks were really frustrated about being cooped up for COVID, and one young man said, you know, just tell me what I need to do I'll get groceries, I'll help people however I can, but I need to get out, but I'm willing to help at the same time. And so that's why I think that, you know, it's really interesting that there's this dynamic and people want to volunteer. They want to help the community. And so what I'm hearing from you, Bonita, is sounds like, you know, one major opportunity to volunteer, or maybe where we need more people, is tech education for seniors.
Yeah.
You know, are there other things that are needed for volunteering, or, you know, stuff like, okay, Meals on Wheels, and Gray Bears locally, do we have those sort of basics covered? You know, what's still needed?
We don't. We need those basics covered, in part because a lot of the volunteers in existing organizations are older adults. So a lot of longstanding volunteers aren't volunteering for their own safety right now. So the traditional organizations, you know, where you think they have and they do have a well-oiled volunteer machine, they're seeing unmet needs. So, you know, those are, I mean, any place is worth reaching out to. I would really recommend the Volunteer Center. We have literally one of the best volunteer centers in the country, and they will coordinate, you know, what your interest is with the agency that needs those types of skills. So if you don't have a favorite organization, if you're like that person you described that was saying, tell me where I need to go, the best thing for that person would be to call the Volunteer Center, and they can do some triaging and look at what, you know, that young man's interests and skills are, and see which organization needs those.
That's good to know.
Right.
Very good.
Is that fair to say that the Volunteer Center is pretty much the best, I don't know, clearinghouse of volunteer opportunities in Santa Cruz County?
Yeah, I think it definitely is.
Mm-hmm. And those connect
And the other thing,
programs, Clay, like any of the volunteer opportunities that you already have. I mean, would someone going to the Volunteer Center be able to end up with you?
they would, absolutely. If somebody calls the Volunteer Center and says, I want to do taxes, they'll hook them right up with us. It always amazes me that we get volunteers for that program, but
I actually have someone in mind, yeah, accountant.
That'd be great. Love to hear from them. You know, the other thing that you kind of hinted at that I want to emphasize is how volunteerism in itself is maybe the best cure for isolation and loneliness.
Exactly.
It's just such a enriching thing for people's lives in whatever, you know, area they do it. I know people have told me, you know, they delivered Meals on Wheels once and it changed their life, just in terms of just their perspective on what they could do or what people really cherish. So, you know, wherever you choose to volunteer, it's just, it's good. It's truly a win-win.
When we were giving out our scholarships, which we do on an annual basis, we usually had, 5 or 6 people who would read through the applications from the students. And I think this year we had about 16 volunteers who wanted to read because they do want to do things to help. And you know, the students, even though there are not a lot of them up on campus, there's still a lot of them taking classes virtually, and they need our help.
Is there anything that local government, you know, particularly county government, can do to assist volunteer programs?
Well, there's one thing. I mean, right now the county does support the Volunteer Center of Santa Cruz County. So that's one excellent thing. Doing referrals is another piece of it. Mm-hmm. One thing that's in the Master Plan for Aging as a recommendation is the Older Californians Act is an addition to Older Americans Act, and it kind of is Older Americans Act plus, where things that California wants to do better than the rest of the nation are included. And one of the recommendations in Master Plan for Aging is that the different programs in Older Californians Act, specifically, there's a volunteer component of Older Californians Act that has never been funded. And if that program were funded, that would just be a boost and shot in the arm to all efforts to get volunteers connected with seniors throughout the state. I think this is especially important in smaller or rural communities. And we all know, Santa Cruz is not the largest community, and Volunteer Center, I mean, that's where we, look to direct some of these funds if it came through. So I think it's easy to have a staff of 10 people in Los Angeles County where there's, hundreds of millions of dollars available to provide or fund agencies. In Santa Cruz County, 1/50th of the size, it's harder to get to those threshold levels to make programs effective, because you can't run a program on 10,000. On a population-based formula, that might be how LA and Santa Cruz compare to each other. But the reality is you have to have, at least a full-time staff to run a program effectively. So that's also a piece that the county could look at is, not only supporting state efforts, or Master Plan for Aging efforts to get there, but look at the reality of, are we having death by increments when programs continually get small cuts? What does that really do to the sustainability of some of the smaller programs?
And I imagine that would be a good argument for combining some of those programs for the Monterey Bay area, for example, between the county of Monterey, Santa Cruz, and San Benito County, which is, in a way, how you operate today, right, Clay?
That is how we operate. Yeah, there's pros and cons to that. And there are some efficiencies, some economies of scale where you get more support, but larger organizations need larger infrastructure and tend to become more bureaucratic. That's not to say they're worse, but it's one of the challenges of it. And, the analogy that I like to put out there is, should we just have one store in Santa Cruz County? Should we have Costco and nothing else? And, the answer to that is obviously no. And that's no disrespect to Costco. I actually love Costco and love their business model and how they treat employees. But, small businesses are important too. And just as we want, cultural diversity in the population, we want cultural diversity in business models. And we also want that cultural diversity in nonprofits. So having more nonprofits really gives more opportunity to people from different walks of life. And I think that's critically important to think about when we look at the greater structure of how we all operate.
Right, and of course there's also not only more nonprofits, but also more effective interaction between them. I'm curious, both Clay and John, if you have integrated programs like OLLI into, what you recommend people take advantage of. I guess maybe this was largely a question for you, John, who are training people to work with their family members. And do you talk about, making sure they get connected to digital communities or, become more technologically literate?
Absolutely. The digital divide, which is a kind of the short phrase for that of getting everyone connected, is real. And we're integrating that in our programs because we're finding just to access healthcare, people who are able to use Zoom, they can talk to our nurse with a photo. If they can't master that, they can still talk on the phone, but they're losing something there. It's not quite fair. So we're definitely doing that. And I think kind of going to the other point of kind of how do we integrate all the different programs. For example, several of Clay's programs my clients at my organization benefit from. We use the emergency response devices. We have senior companions coming to see some of our clients who are isolated. Project Scouts, where we go if we want to someone needs help with their taxes. And certainly, we're always looking for opportunities for our clients, both the older adults, to get out and do things, because we know if they're able. Many of our people are shut in, but then we're trying to make sure they can connect digitally. But then through our caregiver program as well, many of our caregivers are folks who are caring for somebody, sometimes almost 24/7. Sometimes it is 24/7. Well, we'll pay for them to take a break, and an outing like what the Lifelong Learning Center does is exactly what we look for, and encourage folks to do, because that one half a day away where we'll pay for them to have someone come in who's a professional and take care of their loved ones, that can give so much value to a life beyond just what they're learning, which of course, I certainly, I'm a proponent of lifelong learning. But when you're somebody who's been isolated and somebody who's really been, taking care of that loved one, and you can't be away very often, those kinds of programs have, so much even more meaning. So, we all as nonprofits and as, service people and as government really have to work closely together to try to help as many, folks as possible. And that integration is strong in Santa Cruz, but it's an ongoing, effort as well, because we're all, in different places, and we're all, especially in the time of COVID, running a million miles a minute, trying to, all right, keep the doors open.
Mm-hmm. Yeah, well, it's good to hear that that you are working with these kinds of solutions, and would recommend Ollie to your clients.
Yes, please do.
Yeah.
We have so much more fun when things open up, and I'm looking forward to that day again. And I have a group, by the way, I mentioned that we were all volunteers, and I have a great board of about 17 people who just work all the time and come up with great creative ideas, and contribute to our newsletter and help our participants, our members, become participants in some of the activities that we have. So it takes a team.
Definitely.
Yeah.
We've got one question in the chat. I want to make sure you get a chance. Jan and Bob Mountjoy. I'm going to allow you to talk here if you want to ask your question directly. You guys there? If you're still there and want to ask your question, I can see I'm going to ask you to unmute. But if not, you can also pop the question into the chat if you like. I'll leave you there for a second, Jan and Bob, if you get a chance. But I guess my other question for the panelists is, what else do you see that we could do through county government? I mean, Clay, you work with Liftline for many years. So can we improve Liftline services for residents? Or is there more that we could do for housing to create, as I mentioned, more integrated community housing? What is it that, if you could pass one policy or program, or maybe you've got 10, Clay, and you can rattle them off, that's great too. But what would your priorities be for local government when it comes to the long-term picture for, better program for aging?
John's heard me say this before, but to me, the goal is to elevate the conversation about older adults. Do you want to go to Jan and Bob?
Sorry. Jan, yeah, we can hear you. Go ahead. Jan?
I don't know how to do it.
We can hear you.
Do you hear me?
Yeah, we can. Do you want to ask your question?
This is Jan.
Hi, Jan. What question do you have for us?
I appreciate this program very much.
Glad to hear that. Did you have a question for the panelists? Okay, well, that's fine too. We're glad you could attend tonight. And if I'm going to, all right, great. Well, thanks, Clay. What were you saying there about programs that the county should implement?
Yeah, I would just encourage just elevating the conversation about older adults. You know, and unfortunately, we're not cute, we're not puppies, so we tend not to be as popular in terms of the discussing, you know, what can we do to help. And I think bringing up what's going on in the Watsonville skilled nursing post-acute is really a great example. You know, what do you do when you have 50 people living in close proximity to each other and 27 of them test positive for COVID? You know, that's a tough situation. That's a lot harder to deal with creating a day camp for kids to go to. And you know, I'm using extreme examples here, and I don't want to pit seniors against children, because I mean, that's kind of philosophically against what I believe in. But it is a challenge to see things like county homeless service or housing reports, and that there's very little prioritization for senior housing or even senior homeless services. So I think that's a critical piece, that numbers talk and numbers matter. And when reports come out that show that there are twice as many homeless people age 50 and above as there are 25 and under, to not ignore that 50 plus population, even though it may be a harder group to house, because, you know, for example, job retraining is not going to help most 65-year-olds. But just not to shy away from those hard questions, even though serving older adults is more difficult than maybe a younger population. So that would be, you know, using that as an overarching view of county services, I think would do just a tremendous amount of good above and beyond, you know, any one individual program that I would champion.
Got it. Yeah, it's just a mindset.
Yeah, be a priority
Yeah.
and a responsibility of our local government to look at this. And they can't solve all the problems, but by recognizing it as a priority, which doesn't happen often enough, that's the first step, you know. And of course, you need to invest, but you know, but that follows if you're paying attention.
Mm-hmm.
And I think it's good both for the economy as well as it's good for people and for the kind of society we want to live in and doing what's right.
Right. Is there a particular investment that you would prioritize, John? I mean, it would be more senior housing, or what would it be?
I mean, housing is the biggest problem, frankly, for everybody in this community, and particularly low-income seniors. If you're getting, you know, the folks my programs serve, we're serving, they're all folks who have an income of less than $1,000 per month as an individual, and they're living in our community. And that's our job to keep them at home safe. Well, starting with that, that's a challenge. And why even put someone in that position? Now, again, I don't have the answer, and I don't think the county is going to come in and build thousands of housing units, which is kind of what would fix it. On the other hand, if the county doesn't take the lead on that, it'll never happen. So it's got to be part of that solution. And while that isn't specific to housing, that's an issue that you know, is affecting seniors disproportionately, even as that's a growing component of the population. And I think we all agree we don't want to have a community that only has wealthy seniors in it and that drives other people away.
Right.
Or puts them on the street, which is real.
Yeah, definitely. Yeah, housing is the most basic fundamental need we all face, and we need to make sure everyone in the community has safe housing. Bonita, do you want to add anything to that?
Well, you know, I mean, I feel like Ollie is a community in and of itself, and there's a lot of peer-to-peer support there. So, you know, that's the kinds of things that we can do, because it is a good, friendly group, and that's it.
Great.
You know, offering if you have a room, offer it to somebody who's been burned out or something like that. So we try to facilitate that through all of our communication with our members.
Yeah, definitely the number one takeaway I have from this panel tonight is that volunteerism and creating communities through that are pretty much one of the best ways that we can keep the senior population engaged and part of our community. And it's not just youth volunteering to help seniors, as your program with the volunteer grandparents demonstrates. It's also seniors volunteering to help youth. So we're out of time. I just want to thank all of you again for coming tonight and sharing your programs with all of us and really helping to build a greater understanding of how we can change our mindset, change maybe some of our prioritization in county government and in our own lives. And everyone tomorrow can pick up the phone and call someone that they love.
Exactly.
And,
good idea.
Yeah.
And go to the volunteer center and volunteer some time because it'll make you feel a lot better. Good night, everyone, and thanks again for coming.
Good night.
Thank you. Good night.
Good night.
Good night.
Bye-bye.
Thanks for having us. Much appreciated.